Radiologists are often thought of, hey, listen, if you can read a bunch of scans and you never get anything wrong and you get the right diagnosis or the right finding every single time, you are the best radiologist. That's not the best radiologist at RP. The best radiologist at RP definitely does that. But they also put in the extra mile of saying, well, this is what you need to do to follow up on the next part of the report. The best radiologist at RP says, this is how you also lead a practice. The best radiologist at RP says, these are ideas of actually how we can help our patients with new ideas that we can put into our system, or new ways that we should partner with some of our specialists or primary care doctors. The best radiologist at RP does all of those things. That's what makes our organization pretty special.
By having metrics such as clinical practice initiatives or the best practice recommendations, subspecialty focus groups, things that really encourage communication on the national level and make sure that all of our radiologists are adhering to a certain level of standard, helps us to redefine excellence nationally.
Every study that we read there's a person behind it. And they don't even know often that there is a radiologist that is having this impact on their life, and yet it's profound. And this is, I think, what a lot of people went into medicine for. So I think our challenge is really to get back to those roots, to be excellent in caring for our patients, to caring for our communities in a world where there are all these other pressures that are coming in that challenge us to remember what we're really here for.
When we first started talking about advancing quality at Radiology Partners, we were looking at what the standards were around the country and talking about how great it would be if we could take those same standards and then apply it everywhere and bring everyone in the country up to these levels so we're all functioning at the standard of care and we're all sort of going beyond that level. And now what we're doing is even more interesting, it's more exciting. But what's going to be even more exciting is when we set a standard so that groups that aren't even part of Radiology Partners, they have to start doing what we're doing because that's become the new standard of care.
Now, we've been willing to take the challenge head on by investing resources and by investing time in developing clinical value. And we recognize that that's a really big undertaking. And as we've scaled and increased the breadth of what we're doing, it's sometimes tough keeping up with yourself. And we recognize that there are opportunities for improvement, but the passion is there and the commitment is there. And we know that we're leading the way in this area and that we are setting the pace. And that's good for RP as a practice, but it's also good for the entire specialty.
Obviously, our physicians are on the front line and they're the ones that are making these decisions and implementing all of these programs. And really, the first thing that our referring physicians and patients see when it comes to excellence in care. But behind that group of physicians is a whole team of people that are helping support them. So everybody's got a role to play in this mission. Pursuing excellence is part of what leads us to being able to achieve that mission of transforming radiology.